Hi, I'm Mary Ann Griffin, Executive Director of Senior Services of Alexandria, and I'm here with my colleague Mary Ann Griffin to talk about the services that are offered in the City of Alexandria for seniors by the Division of Aging and Adult Services. Hi, Mary Ann.
Hi, Mary Lee. Nice to see you.
Nice to see you too, as
Thank
always. So tell me a little bit about yourself and what you do at the Division, and then what the Division does in the City.
Well, I've been with the city for 10 years as the division director and have a background in gerontology that goes back many, many years before that. The city has consolidated all of the publicly funded services for aging and people with disabilities into our division. And we have 7 major programs. We have the home and community-based services such as Meals on Wheels that we contract with Senior Services to do. We have an employment program. We have adult protective services. So we've really covered the whole waterfront in terms of the services that are available to the seniors and people with disabilities.
And about how many seniors do you service in Alexandria?
It depends on which program. Probably all told somewhere around 5,000 people. That includes people who use our transportation and people who get Meals on Wheels and people who go to our community, our congregate meal sites in the community. So about 5,000 people altogether.
And I think a lot of your programs are managed, and the services that you provide are through an extensive social worker system. Is that correct?
Yes. The services under Adult Protective Services and Adult Services, which is case management and companion services, all of the people who work in those 2 divisions, as well as geriatric mental health, they are all master's prepared social workers, MSWs, and there's a PhD psychologist as part of that group. So the direct hands-on employees of the city that provide that are in those 3 areas are all professional social workers.
And those services, social worker services and that type of thing, are those offered to all citizens, or is there an income requirement, or how does that work?
Well, I think that's probably one of the biggest misconceptions about the services in the city, because I think people tend to think, oh, it's government, therefore you have to be poor.
Right.
And indeed, that's actually not the case. There's only 3 out of the 12 or 13 programs that we have actually that have an income requirement. And the reason they have income requirements is because money comes from the Administration on Aging and the federal government, money comes from the state, the Division of Aging at the state, and within those 2 parameters there are income requirements. But certainly adult protective services are not income-based. With the geriatric mental health, those are not either. I mean, if a waiting list existed, we probably would give priority to people who didn't have another option, but there is not an income limit for those. And with the adult service program, we have universal access to case management, so we have master's prepared social workers. Anybody can call us on the phone at any time. Families from out of state, families who live here, seniors themselves, and we will do, if it can be done on the telephone, it will. Otherwise, we will make a home visit and make an assessment and then help to refer them, because we are, the federal government has designated the Area Agency on Aging as the No Wrong Door Aging and Disability Resource Center. So we're the, one-stop shop, go-to place. The other program, though, that is in adult services that does have an income limit is the Companion Aid program, and that's a non-skilled program for light housekeeping, grocery shopping, and that sort of thing, which we think is really vital to helping keep people in their homes. But that's partially funded with the Virginia Department of Social Services, and as a result, it is low income. It's 50% of the state median income, and that's about $1,300 a month or so for an individual.
Sure. Can you talk a little bit about the transportation program that you have? I'm familiar, of course, with the transportation program for the disabled, but I know you have the senior taxi program, and also something that I'm always trying to get people to learn about and take advantage of, and that's the door-through-door program.
Yes, be happy to. Well, first thing is we actually run our own transportation. We run group transportation. We have 2 28-passenger buses that run all day, every day, taking people to the senior centers and shopping, etc. And as you mentioned, there is the senior taxi program, which has changed dramatically in the past year,
Sure.
and basically is now called, I think, the Yellow Card program. But it is available to people in the city whose income is less than 60% of the city's median income. We subsidize basically vouchers for them, and people can go anywhere they want, any day of the week. They have X amount of dollars to spend every quarter, I'm sorry, and then they renew every quarter. And while that's different than it had been before, it offers a lot more flexibility in terms of being able to go any time of the day or night, anywhere. A program that is dramatically underutilized, unfortunately, is called the Door Through Door program. And that is a joint program with the Arlington Area Agency on Aging and a home care agency in DC called Home Care Partners. And it's a federal New Freedom grant that we got a couple of years ago. And basically what it provides is it provides accompaniment of a certified nursing assistant or a home health aide if someone has a medical appointment. And because it's both Arlington and Alexandria, anywhere within a 10-mile radius of either of those to medical appointments, and there's no age requirement. So what's available is that the person will contact the home care agency, and we certainly have that number, and they will make arrangements, and the certified nursing assistant can go to their home, help them get ready, get into the taxi cab, go with them, come back, help them get ready, get lunch, whatever, but 4 hours, and it's completely free.
I know, it's a wonderful service.
It's a wonderful service, and we try our very best to make people aware of it, that it exists.
Well, that's why I wanted to make sure we mentioned it, so we get the word out.
And even though it certainly, any age can use it, I think it's very beneficial, particularly in the case of seniors, because what it means is that an adult daughter or son doesn't have to take the afternoon off to take mom to the grocery store.
And they have to provide, or they pay for the transportation itself.
They pay for the transportation themselves. If it's someone who's using the DOT paratransit program, the aide can ride free as accompaniment, but if it's any other form of transportation, they would have to pay, for example, the taxi fare for both themselves and the aide. But otherwise, the aid is free.
But 4 hours of an aid is
4 hours. That's exactly
a lot.
right. It's a lot. And so the agency would even help them coordinate with the doctor's appointment when someone was available. So we would love to have it more readily used than it is right now.
Well, good. I hope we get some more people using it
Thank you
because
for
they've
bringing
heard.
it up.
Sure. So let's talk about how we work together, Senior Services and the division. I know we do an awful lot of things together. I'm not sure everyone else knows how much we do.
Well, we certainly contract with Senior Services to provide the Meals on Wheels program, and that's enormously helpful. And I don't mind talking to Mary Ann Beatty at 5:30 in the morning. We'll be doing meals on that given day. But I think the other way is really the collaborative. We've certainly done the resource corners together and get out into the community and do a lot of joint presentations, and I think that's really advantageous for both of our agencies because nobody can do it all. So I think being the not-for-profit working with the city staff, it's been beneficial, I think, all the way around.
Oh, absolutely. I mean, I really enjoy working with your staff, and the cooperation, I think, between the two organizations is really great to see. You want to see city organizations working together as a team. So I know we often are try and make sure that we have people from the Division of Aging on the panels for our speaker series events, because you just have such a wealth of knowledge, and getting the word out is what it's all about. So what else do you want people to know about what you guys do?
Well, I think probably one of the newest programs, and we haven't really had an opportunity really to promote it much, is the Experienced Worker 50 Plus. I mean, we've both worked on that together, but it's up and running. It's a totally, hard to believe, but totally free program, and we're really gearing to people who are over the age of 50, because we know ageism is alive and well in the workplace, and people who've retired and then find out that they don't have sufficient income to stay retired, people who are retired and bored, etc. So we've created a sort of one-stop shopping through JobLink, which is a city employment program, and it's sort of a soft handoff. It's meeting with one individual and then being able to transition to one employment training counselor. And we actually have seen 63 people since May, and we've about 25% of them so far have gotten jobs. And I think that the key here, because a lot of older people have never applied online. They have no
Right.
idea how to do that. They
Sure.
don't understand the use of social media. So we've had a LinkedIn class, and we brought people in to do transitional workshops to understand, you know, how to frame it. You're not unemployed, you're in transition.
Right.
And so it's just, I think it's a really, I've been very, very pleased with how well utilized it is. And I think, again, that goes back to our shared resource corners. Most of the calls have come from the library senior
Right.
corner. So I think our outreach has been effective. Collective outreach has been very effective.
And we really do want to thank the library for starting that program off. And we now have 12 senior information corners around the city that we stock with literature about services provided by the Division of Aging and others. Well, I want to thank you for being with us today.
Thank
It's
you.
always
It
a
was a
pleasure to
pleasure.
be with you.
Thank you.
And look forward to working with you on some future programs.
Thanks.
Thanks.